Okay, welcome back to Chapter 2 of the Emergency Medical Responder Program. In this chapter, we're going to cover workforce safety and wellness. All right, so workforce safety and wellness. Basically, this is using simple knowledge of our EMS systems to make sure that we ensure the safety and well-being of the emergency medical responder, and also the medical legal issues at the scene of an emergency while waiting for a higher level of care. Right, so the competencies that we're going to take care of today, we're going to talk about safety and wellness to concern ourselves specifically of standard safety precautions, personal protective equipment, stress management, dealing with death and dying, prevention of response-related injuries. Also, in medicine portion of it, we need to recognize and manage life threats based on assessment findings of a patient with a medical emergency while awaiting for additional emergency response. Also from an infectious disease standpoint, we need to be aware of a patient who may have an infectious disease and also how to decontaminate equipment after treating a patient. All right, as an introduction, you and your patients and their families can experience various degrees of stress and grief during the following or during and following a medical emergency. So in order to fulfill your duties as an EMR, you need to be in good physical condition. You should have a complete physical examination to ensure that you're healthy enough to do your job. And this should be done on an annual basis. We have to keep up with our health. I tell you, it's just, I go to the gym, I like to go to the gym at least 3 days a week. Make sure to eat right, get enough sleep. Rest is very, very important. And to be able to perform those duties, because there is a lot related to stress and physical exertion in emergency medicine. All right, so you must also learn how to avoid unnecessary stress and how to prevent your stress level from getting too high. The most stressful calls include a patient who reminds you of a close family member, the very young patients or the very old patients, and also critical patients. And of course, there is death. We have lots of death in what we do because sometimes people die or people have been injured so badly that there's nothing that we can do for them and they do die on scene. All right, so continue on. Also, those that have an unusual danger point, violence, unusual sights and smells or sounds, and then mass casualties. As you can see, we're dealing with a child here. And in this child is injured enough that they're putting the child in a restraint device. As you can see, mother is quite concerned. I assume this is mother, this is a responder. That may be dad here. I don't really know, or it could be another responder. But either way, you have to manage not only that child, but you're also going to have to manage the grief and the distress of the parents as well. So these are things that we're going to talk about and teach you. All right, so you must take a conscious effort to prevent and reduce stress. Learn how to recognize the signs and symptoms of stress is very, very important. And then, of course, you can adjust your lifestyle to include stress-reducing activities, such as fishing, sewing, swimming, whatever it is that makes you feel good is what's important. There should be more good in your life than bad in your life, as much as possible, because you got to feel good about yourself. Also, you need to learn which services and resources are available to help you in case you need it. All right, so normal reactions to stress. These are two different slides. There are 5 stages of reaction to death and dying. First one is denial. This is when the person is experiencing denial. They cannot believe that this is happening. They're in denial that this is going on, that this person is dying or this person has died. They're in total denial. The next one is anger. Anger is a normal reaction to stress and will sometimes be directed at the responders. They don't mean it intentionally. They're just lashing out to somebody to try to dispel the anger that's building up inside of them. Next one is going to be bargaining. The act of trying to make a deal to postpone death and dying and the feelings that come along with that. So it's called bargaining. And then finally, the next 2, depression and acceptance. Depression, the patient will usually be silent or seems to retreat in their own worlds. They become depressed that this is the path that they're heading down if they haven't already passed, but they will become pretty silent and try to crawl within themselves and fall in a state of depression. And then ultimately, there will be a level of acceptance. The patient and or family member understands that death and dying cannot be changed and it's going to happen. So those are the 5 stages of the reaction to death and dying. And pretty much so the reaction to stress itself. All right, stress management, 7 slides talking about this. Recognition of stress. So we need to look for these warning signs. Irritability, inability to concentrate, change in normal disposition, difficulty in sleeping or nightmares, anxiety, indecisiveness, guilt. Okay, these are warning signs that we should be, looking out if we're having any of these, or that if our co-worker is having any of these, we need to recognize these and try to steer ourselves or our fellow co-worker into getting some help. Also continue on, the loss of appetite or overeating, loss of interest in sexual relationships, loss of interest in work, isolation, feeling of hopelessness, alcohol or drug misuse or abuse, and then some physical symptoms to include elevated blood pressure, elevated heart rate, respiratory rate, those kind of things. We can have many of those, nausea, vomiting, any of those could be additional signs of stress or warning signs. Right, so managing this, preventing stress. Eat a healthy, well-balanced diet to help prevent, reduce the stress. Obviously, we need to have a very good mixture of all of the food groups, fruits, grains, proteins, vegetables, and dairy. ChooseMyPlate.gov is a very good site to go and look at different dietary things that we can do, or dietary combinations of all of these to be healthy and well-balanced. Here's a nice diagram. This is also in your book. Talks about grains, vegetables, fruits, milks, meats, and beans, and how to mix that, how to balance food and physical activity, and know the limits on fats, sugars, and salt and sodium. All right, water. Huge, important. Water, water, water. Why? It's because water filters all of our stuff out. Drink adequate amounts of fluid every day and avoid consuming excessive caffeine and alcohol. Be merry. Learn to balance your lifestyle. Need to work on being happy. Drink lots of water. It'll help you in preventing the stress. All right, other ways to prevent stress: spend time with your friends and family, develop hobbies or activities that are not related to your job, exercise regularly, meditation or religious activities is good, and then assistance from mental health professionals as necessary. Reducing your stress, you may benefit from the help of a mental health professional who is trained to listen in a non-judgmental way. There is nothing wrong with going to see a therapist or a psychiatrist. There's nothing wrong with that. It very well may help you. And if you have incidents that are of a high stress type of environment, your department should be relevant to or acceptable and push you towards critical incident stress management. This is a comprehensive stress review that's available through some of the public safety departments. It's a series of different types of management techniques that will help us manage our stress, especially after high volume incidents and those kind of things. Workforce safety. It is dangerous out there. You will encounter a wide variety of hazards and emergency scenes as a first responder. It is important for you to be able to recognize these types of hazards and also know what steps to take to minimize the risks that they pose to you, your patient, your partners, and anyone that may be on the scene. All right, let's talk about infectious diseases and standard precautions. What does this mean? It means that we have all kinds of infectious materials out there that we can be exposed to, that we need to make sure that we have a general understanding of what they are and how to protect ourselves. So most common routes for transmission of any nasty boogers that are out there that may get you. 1 is contact with infected blood. 2 is contact with airborne droplets. 3 is direct contact with infectious agents. First one we're going to talk about is bloodborne pathogens. This is disease-causing agents that are spread through the contact with infected blood. HIV is transmitted by contact with infected blood, semen, or vaginal secretions. Bottom line, wear gloves. Okay, wear gloves. Hepatitis B is also spread by direct contact with infected blood, but is far more contagious than HIV. So the biggest thing about blood-borne pathogens is we want to avoid direct contact with the blood. So make sure you're wearing gloves, make sure that you wear goggles, some kind of safety glasses. That's very, very important in case blood gets splattered, which in many occasions it does. When patients have blood that's all over them, they tend to be frailing about, and blood can actually get in your eyes, which is not a good thing. So make sure safety glasses is on your list. Airborne pathogens. Tuberculosis, TB. It is a contagious disease that is spread by droplets from the respiratory system. Wear a mask or a high-efficiency particulate air, which is HEPA, respirator, and put an oxygen mask on the patient. You should have a skin test for TB every year just to make sure that you are negative, okay? Let's take a look here real quick. Let's see, influenza, whooping cough, and severe acute respiratory syndrome, SARS, are also spread through airborne droplets. So again, this is something that we can protect ourselves. If you have a patient who's coughing, plain and simply, have them wear a surgical mask. If they can't because you're putting them on oxygen, then you wear a surgical mask. Direct contact. All right, so now we have direct contact. We had blood contact, we had indirect contact, now we have direct contact. Methicillin-resistant Staphylococcus aureus, MRSA, staph infection. It is infection caused by the bacterium Staphylococcus aureus. Most MRSA infections occur in healthcare settings such as hospitals, dialysis centers, and nursing homes. MRSA is most commonly occurs in people with a weakened immune system. We have Staphylococcus aureus everywhere. Okay, staph lives everywhere. There's certain levels of staph that are actually good for us because they give us certain levels of immunity to other antigens that may be within them, or to maybe present themselves in a way in your home or in the facilities that you may be becoming involved or infected with it. MRSA can also be involved in the respiratory system as well, and is most commonly, like they said, in hospitals, also nursing homes. It is what they call a nosocomial infection. It's spread because from one patient to another. And very simple example of that is if a healthcare worker is treating a patient with MRSA and does not wash their hands before they touch another patient, it is spread in that manner. So that is called a nosocomial infection. All right, so standard precautions. Assume that all patients are potentially infected with blood-borne pathogens. Use your protective equipment. Always wear approved gloves and change the gloves after contact with each patient. Always wear protective mask, eyewear, or a face shield when you anticipate blood or blood splatters, okay? I always make sure to have eyewear. I wear them around my neck, okay? When I fly as a flight medic, I keep it around my neck so I can always pull them up before I begin treating patients as I approach the patients. So eyewear, safety glasses, and they need to be clear, not sun. Not polarized, because the thing is that you should only have one pair of eyewear. And so that way, you never have to search which ones that you're going to use, and you may be going in and out of dark environments to light environments. So they really need to be clear. All right, so number one way to reduce the spread of infectious diseases: wash your hands with soap and water. 20-second rule: put your soap on, get a lot of friction, keep going. You can sing row, row, row your boat, or Old MacDonald Had a Farm, or whatever you need to do, but 20 seconds worth. Count it out yourself. Also, if you are involved with a scene where paramedics are using needles, don't recap a needle. You need to make sure that you either cut or bend those. Don't cut, bend any of those needles. You need to make sure that they go into a sharps container. Don't accept a needle. Don't take it from the paramedic and then put it in there. Offer the sharps container for the medic so they can drop it into the sharps container themselves. All right, continue on. Skill drill 2-1. It's chapter 2, number 1 in your book for the proper removal of gloves. You're going to need to practice that. It is one of the skills that we'll be performing with your instructor that's doing your skills for you. Immunizations is another important part of protecting yourself and infection control. Influenza, tetanus prophylaxis, and hepatitis B vaccines are recommended for EMS providers. You need to check the status of your varicella, measles, mumps, and rubella vaccine. And then tuberculin testing should also happen at least on an annual basis. And then if you can't have testing, you'll have a chest x-ray once a year. All right, so responding to the scene. Scene safety is most important consideration for you as a first responder. It includes your safety, the safety of all the other people present at the scene. An injured or dead EMR, first responder, cannot help those in need. So you need to make sure to cover yourself first. Drive safely and always fasten your seatbelt when you are in your vehicle. All right, so dispatch. Use the dispatch information to anticipate hazards and determine how to approach the scene. And your response, make sure your seatbelt's fastened and plan the best route and drive quickly but safely to the scene. Parking your vehicle. When you park your vehicle so that it protects the area from traffic hazards. Be sure that the emergency warning lights are operating correctly on your vehicle. Be careful when getting out of your vehicle because traffic tends not to stop. They will go around you. They are on a mission. They're going to work or wherever it is. They're not paying any attention whatsoever. So be very careful getting out of your vehicle. All right, so wear approved safety vests. See, these folks here wearing these bright green safety vests, and it's during the daytime. It does not matter. Make yourself visible on that scene. The more visible, the better. If your vehicle is not needed, park it out of traffic. Get it out of the way because the responding other vehicles, especially your transport vehicles, need to get into the scene. So don't block the roadway. Scan the entire area. This is assessing the scene. Scan the entire area to determine what hazards are present and address them in the most appropriate order. So the first thing is scene safety, folks. We're doing scene safety. All right, so traffic. Control the flow of traffic on a busy highway. All right, that's going to be one of your first duties versus managing patients because that's going to be part of your scene safety. If you need assistance, call before you get out of your vehicle. Make sure that you get law enforcement or whatever you need if you need assistance. Crime or violent scenes, if you are trained in law enforcement procedures, follow your local protocols. If you are not, proceed very carefully. If you have doubts about the safety of a scene, wait at a safe distance and request help from law enforcement officials. If the scene involves a crime, avoid disturbing anything unless it's absolutely necessary. Try to stay away from it because that's called crime scene preservation. Crowds. Sometimes a lot of people can gather. Assess the crowd's mood before you get into a position from which you cannot exit. If this crowd is, angered, violent, you don't want to be in the middle of it. Make sure to request help before the crowd is out of control. Electrical hazards. Many times you'll have electrical hazards such as down power lines. Don't approach the scene and keep other people away from the source of the hazard. If you see that there are down lines, and don't second guess it. They may be TV cable lines, but you don't know that. They are down lines. You can't always see the electricity. It may not be obvious. It may be running through the liquid that's on the ground. So please make sure if you see down power lines, you get professionals to manage it first before you help out whatsoever. Do not approach those scenes. All right, make sure the electrical current has been turned off by qualified personnel before you get close to the source, like we mentioned. Wear a helmet, a chin strap, and a face shield. We have to protect ourselves. With fire, if you're a trained firefighter, follow rescue and firefighting procedures. If you're not a trained firefighter, do not exceed the limits of your training. Never enter a burning building without proper turnout gear and self-contained breathing apparatus, or SCBA. Hazardous materials, most of the time in your world as a first responder, you will see that this is a truck that that it's a tanker truck or it's a cargo truck and it's got these placards on it. Those are those triangle look placards. They should be marked and they should tell you that there's hazardous materials in there. Do not approach those vehicles. Do not approach those scenes until hazmat teams have properly mitigated those problems. Here are some common placards. This is in your book. It shows all the different types of placards and what they mean. These are triangles that are on the sides of those vehicles. Do not approach the scene if you see these triangles. It is just best not to. Let the professionals manage this, and then you can, approach the scene once that's been managed. All right, if you believe that a crash may involve hazardous materials, again, stop uphill and upwind and use binoculars to observe the scene. So you're doing this from a distance. If you see that it's a major tanker truck, as you're pulling up, stop and then look, okay? Use binoculars or use something that you can see. So that means that something else that you need to carry along in your vehicle would be a set of binoculars. That is a very, very good idea so that you can see what's going on ahead of you. Odors or fumes may be the first indication. You need to call for assistance. Do not approach that scene. All right, so unstable objects, vehicles, trees, poles, buildings, cliffs, anything, piled up materials, anything that may be, unstable. Do not approach it because if it falls, it's going to end up, you're going to get crushed and you're not going to be able to help anybody. Right, vehicles may need to be stabilized before the patient extrication can begin. Also, airbags. Airbags are a hazard. If you have a patient that's still in the car and the airbag has not been deployed, you run the risk that if you try to get in and help this person, that airbag may deploy. So don't do it. Wait until after EMS arrives. If you can get them out of the vehicle safely, if there's no contraindications to that, then that's fine. But don't put your head in there because many people have been killed because of an airbag has gone off and they've leaned inside the car when it did, and then it ended up breaking their neck. So very important to be aware of that. All right, so fires and explosion can result in unstable buildings, so make sure you're not entering any of these buildings at all. Make sure you're calling for help and observing and helping anybody that comes out of the building. Sharp objects. There's a lot of broken glass and metal and all kinds of stuff on the scene, so if you do not have turnout gear, stay out of it. Make sure that you don't get cut by any of these objects. Wear heavy leather or firefighting gloves over your medical gloves to prevent any injuries. Don't forget, animals. They can be pets, farm stock, or wild. They should be just secured in another part of the house away from the patient. They may be present, they may present, other hazards such as bites, kicking, or even trampling. So again, be aware of these animals. Make sure that you don't get hurt by any of them. That's part of your scene safety. Environmental conditions, obviously you need to dress appropriately for the weather. Make sure that you're warm enough, make sure you're cool enough, those kind of things. Be alert for damage from high winds. Keep your patients dry and comfortable, and use emergency lighting when operating in the dark. All right, special rescue situations, water rescuer, ice rescuer, confined space or below grade rescuers, terrorism and mass casualty incidents. All of these should be if you are trained to manage them, okay? Don't enter an emergency situation that's unsafe unless you have that proper training and the equipment that goes along with it, bottom line. All right, so in summary on Chapter 2, stress is a normal part of the EMR's life. We need to know how to reduce it. The 5 stages of the grief process, or when dealing in death and dying, are denial, okay, denial, anger, bargaining, depression, and acceptance. Stress management consists of recognizing, okay, preventing, and reducing critical incident stress. You should understand how airborne and bloodborne diseases are spread and how standard precautions prevent the spread of infections. Remember, we covered that. You need to protect yourself. As you arrive on the scene of a collision or illness, you must assess the scene for hazards. It's called scene safety. That is the very first component of the assessment process. Scene safety to include traffic, crime, crowds, unstable objects, sharp objects, electrical problems, fire, hazardous materials, animals, environmental conditions, and special rescue situations, and also infectious disease exposure. All right, so as a review, the requirement of this program on every single case, on every PowerPoint, there are 21 lectures in this particular series. We have at the end of each one of these lectures, you have a review. So read each review question carefully. Then pause the video as necessary to read the questions. It's okay, you can pause it. Then I want you to open your email and type in the following information: your name, the chapter number that you're responding to, the question number that you're responding to, and the answer of that question, A, B, C, or D. And then you must give me a short rationalization for the question. You know, why is that answer correct? What is the information that you've learned that supports that answer? And then finally, you need to send it to or email it to us at student@emets.net. It's right up here for you. Here you go, student@emets.net. So let's take the first question. All right, as a review, here we go. Here's the questions. Remember, you need to submit them to student@emets.net. Common signs or symptoms of stress include increased appetite, decreased muscle tension, greater ability to think clearly, or irritability. Common signs and symptoms of stress include. You are called to a scene that seems to be unsafe. What is your best course of action? Refuse to respond, wait at a safe distance and request law enforcement officers, proceed to the patient but with caution, put the needs of the patient ahead of your safety. Which of the following is not a consideration when responding to an emergency scene? Road conditions, other drivers on the road, personal safety such as a seat belt, always use lights and sirens. Okay, folks, that's the end of this lecture. We want to thank you for your participation in the program overall. Again, if you have any questions for your instructor, please email them to student@emets.net, and we'll see you next time. Have a good one.